here anyway. So I went to Oxford in 2012 to start a new research centre on fostering. A number of you, certainly at that point and probably even now, know a great deal more about fostering than I did and still do. But the purpose, which is very close to the heart, I think, of what we're trying to explore this evening, of me running it, was because it's sponsored by independent children's services company, a group of companies actually, and they wanted that relationship between research, policy and practice to be different to what they saw as traditional ways of working. So that's what it was all about. So the centre, I'm going to spend very little time on this, just introductory remarks about the centre and its work to set the context for sort of what I'm drawing on, really. But most of it will be to try and take up Barry's challenge. I've actually copied out the little sentence that was in Barry's email into one of the slides. But the centre is there to try and improve the life chances of children and young people in foster care. And much of what we do is much the same as what lots of people do, reviews and all the rest of it, renew projects, looking for money from different funders and so on. I think crucially, because we were told at the beginning by the funders that there wasn't any research on foster care, which we were sure was wrong and was wrong, but clearly they weren't accessing it, which I think is the nub of the issue for all sorts of reasons. That doesn't mean it's not accessible, but they weren't accessing it, they weren't using it. And so the first job was to try and bring it into different forms, different ways of bringing it to their attention and to the attention of other people like them, so that it would be more usable. And so the publications on the table over there, which are not for sale, contrary to what Barry implied when I opened the box, we don't sell anything because we're funded to distribute to the services. That's part of our funding. A great chunk of funding every year is, I think it's about 15,000, goes on printing and distribution of publications. And that tells you straight away, it's also a great chunk of our time. And that's a different way of thinking about research, actually, to the ones that traditionally, certainly when I started, which is now 38 years ago, in research, you didn't have time built in for dissemination at all, not even a minute's of time. There wasn't an impact agenda, and the whole thing was very different. Now, I would say that in the Rees Centre, we probably spend between a third and a half of our time consulting people about research priorities and communicating with people and preparing communications. So that's a very big chunk of time. And if you have funders who don't go along with that, then you're clearly, in difficulties. So we try to only initiate new research where there's gaps, and that's why that side of our work has only started quite recently. The other part of this then, just to mention, it's not new. People in this university, particularly actually in this department, were doing this kind of thing before, and in fact Susie Bray in particular and Marion Barnes, who at the time, I think she's still at Brighton. No, she was at Brighton, no, at the time at Brighton University, was working in this way with disabled people. We became very much developed this notion of actually engaging service users and other people in the system, service providers, with more developed roles in the research. In particular, we have now 24 foster carers and about 10 young people. The number of young people changes quite rapidly because their situations change quite rapidly, who are trained as interviewers and who do a lot of interviewing. The foster carers mainly on the telephone and the young people mainly face-to-face. More recently, and this is where I want to be brutally honest and say this is the side of our work we haven't cracked yet, and we'd be interested in your views. We employed somebody full-time to develop research mindedness in the services. and that hasn't gone swimmingly, and that person has decided to give up and go elsewhere, and we're starting that work again. So having to rethink whether it was the role that was wrong or the commitment that was wrong from other people or exactly what's gone wrong there. So, you know, that's an area where I would not claim to have the answers, but I think it's a very exciting area, one which the programme that Barry referred to, the innovation programme, which I'll say a little bit about, is developing as well. I'm not going to read all these out. These are the reviews. There should be some copies of each of them there. They're all done. They've all been done in-house, as in from our own resources, prompted right from the beginning onwards, prompted by different service providers. At the beginning, the work, those three, were very much, if you like, requested by our funders, the Core Assets Group, as we became better at and developing consultation with foster carers in Oxfordshire and in other groups, and young people and social workers from other places not involved with the Core Assets Group. So some of these, the impact of fostering foster carers' own children, was requested by a group of foster carers in a completely different setting. And the mental health interventions was actually a piece of work for the NSPCC. And I'm going to come back to that one. So these have all been stimulated or requested from somewhere else. We don't do everything we're asked to do. We do find out first whether we think it needs doing. It's been done before. People, again, don't always know what's already available. And most of these are ongoing research projects from the third one down. Only the top two have been completed and still not published. But the third one down, you'll see the third one is actually in conjunction, I don't think Robin's here, is he? But with Robin Banerjee here and the Surrey NHS Trust, who I think you're working with on another project, Mary, John. So that project is jointly run at the moment. We have a number of jointly run projects, and others are funded. The education one, which I'm going to mention at the end, is joint with Bristol, with David Berridge and Sally Thomas, who's actually in education at Bristol. The London evaluation of the London Achievement for All Foster Carer Training to support education is collaborative with Loughborough, and that's about it. Okay, so this was what Barry asked me to do. Research, policy and practice, how do they speak effectively together and with integrity, where innovation is the primary task? Now that last bit threw me into a bit of a panic, because I seem to remember a historical moment in the past where we had a joint project between education and social work with beloved departed friends, Viv Griffiths and Carol Robinson and Fran Hunt. And we tried to define, and actually I should say the Centrim team, which is a management unit between Brighton and Sussex universities, and we tried to define innovation. And from time to time, astonishingly, people ask me for this report from time to time, not very often, but I'm almost run out of copies. So that was the Nesta report, and it was a bit of a job to try and work out what the definition should be. And actually, I think the other problem that we had, and which I continue to have, is a kind of assumption which organisations like Nesta are particularly strong on, which is that innovation is necessarily a good thing. And I have a bit of a problem with that, really, because I think the more we look at children's social care, for example, we don't actually need more ideas on everything. There are some things where we probably need more ideas, but in many cases, we need to be clearer about how we can get the ideas we've got, many of which have been tried and tested and found to work quite effectively, into practice. And not we, but how we, with services, can actually work on what people have variably called, and I'm afraid, Elaine, I only came across the paper just shortly before the session in which you define and explain the difference between two terms, which was actually very useful. One was what I would now probably call knowledge adoption, and the other one was evidence-based practice. And I think we've probably done a disservice by focusing too heavily on evidence-based practice, which feels a bit imposed and directed, and what in education with the literacy strategy we saw as a way of stopping teachers from thinking and getting them just to follow a manual. And I think that's a kind of understandable fear in that sort of approach. And so the sort of debate about the knowledge adoption seems to me to be very important and doesn't necessarily always require more innovation. So that's a terrible thing to say when one is responsible for the evaluation of the innovation programme. But I do have that problem, and we'll come to it again and again in here. So the definition we were provided with by Nesta, the development and dissemination of a new product, we had a lot of trouble with the product bit, service and process that produces economic, social and cultural change. The reason I've highlighted produces economic, social and cultural change is because that's almost exactly the wording in the ref for impact, for part of the definition of impact. And so you can see that we didn't have the ref when this was published, 2009, I think it was only just beginning to be developed, that side of the ref. We had the ref, but not in that form. And I think that while we can all identify areas of children's social care, for example, that clearly need economic, social or cultural change, we don't necessarily need it everywhere, and we don't necessarily think that innovation is the best way of it coming about. And the Nesta definition did allow us to think in terms of that the innovation could be in terms of how it's implemented. And I think that's quite important for us as researchers, because arguably it's also about how it's evaluated. And we've tried to look at that within the innovation programme. So these are the 4 challenges I want to set. And they're not new ones, I apologise, they've been around. I want to try and push on with the progress where we've made it and other places where I think we still got a bit stuck. And so the first is about generating and translating research findings, data analysis, etc., including the evaluation of others' innovations that are capable of leading to improvement. So we are starting on the basis, I am starting on the basis that this session isn't about generating theoretical models for other researchers. For the moment, I'm focusing very much on that practice and policy side. And I think in terms of thinking specifically about the innovation programme, this informs thinking about the improvement as informing subsequent sustainability rollout and maybe further innovation. And I'm thinking that maybe that area is one, and when we come and talk about transferability, is particularly important for those of you working in international context, which I'm not at the moment. Well, a tiny bit in Japan, but it's so quirky that not to be helpful to the kind of development opportunities that you're involved in. It's just about getting their young people out of residential care, basically. So the second challenge is finding ways of ensuring you get through to these policymakers at the right time. We'll come back to that, about the timing. The third is about developing practice. So if you like, this one is saying, okay, I've got my research, what am I going to do with it? How am I going to get it through? How do I decide what the research should be in the first place in terms of trying to bring about improvement? Whereas this one is very much starting at the practice point and saying, if I'm working with a service provider, how can I get them into a discussion about how they develop evidence within the service, how they use evidence within the service, and so on. And I think this might be the one where we got a bit bogged down with our research mindedness work. And finally, how you maintain your research integrity throughout. And interestingly, when I thought about it, although I have had a few little blips on the research integrity side, since being at Oxford. The bigger challenges I had were in 2 projects here with colleagues who I think are not here at the moment, but anyway, which I can make reference to without the funders, and then hopefully slightly anonymise them. So I think the question is, which of these 4 you think you're making progress with, and where the sticking points are? And my judgment of Sussex work in ESW in general, and certainly of social work, would be that this is pretty good, actually. The research integrity looks pretty good to me. And I think it's not least because you have had some people really putting their, their energy into thinking about that. So I think that's particularly strong. I'm not sure where the weaknesses are, but I think that's particularly strong. Okay, so the Children's Social Care Innovation Programme is just one part of our work, but a rather big part of it at the moment. And it runs through, we run through till the September of next year on it. The actual projects are required to report in March next year, although they don't all finish then. Most of them don't finish. Some of them lose their evaluations at that point. There are 57 projects. On the website it says 53. That's because they treat the National Implementation Service as one project. But it's 4 distinct projects. You are evaluating one of them, Adopt, and it's Adopt, Result, and you... okay. Sorry? Yeah, no, I meant you as in Sussex, sorry. Sussex are doing Adopt, the Adopt evaluation, and then there are 3 others which are also National Implementation Service projects. So 2 types of multi-systemic therapy, and 2 different types, and 1 project which is a residential care programme called Result, that you may know about. So that's why I call it 57 projects, 22 evaluation teams, and we're supposed to provide quality assurance to all of that, and the overriding evaluation of it. Over half of the projects are local authority led, 55%, and over half of the local authorities in England are involved in the programme. Now, a slightly cynical view might be, I think, given we record, you have to be a little bit careful how I phrase this, but a slightly cynical view might be that the funding has been withdrawn from local authorities, and that this is a way for some of them to get their funding back. And certainly, I think it would be fair to say that part of our role is to push, and with the evaluation teams to push a bit, to see whether there's actually anything happening over and above funding what was already happening anyway. And that's always a potential concern. I think with the independent or the charitable organisations involved, that's actually less of a worry, because they're more likely to use it as an opportunity to do something a bit different, or that they were hoping to do. There are 3 main areas, and the Rethinking Social Work, Children's Social Work, the support for adolescents, which I call 5 projects that on the website, again, you'll see that they are claiming, I don't know, 15 or 20 in that area, because projects which are providing things like addressing areas like child sexual exploitation or mental health are being categorised as support for adolescents, whereas I'm only classifying the ones that are whole system change for adolescents. So typically where social care is working with the offending service, with the probation service, with the police, with all the different groups working together. And I would say that's a challenge to the evaluation teams in terms of interdisciplinarity. So a lot of these, especially these big system ones, require evaluations which are very much multidisciplinary. And then a whole host of other projects which cover adoption, residential care, mental health, housing, all sorts of things. And I've put here truly innovative. Are they truly innovative? Well, some of them definitely are. I think at least one of the ones that you're involved with, you would probably describe as fairly innovative. On the adoption side, I think that the one that Stoke City Council are doing, which is to set up a housing cooperative for care leavers to manage their own houses. That's innovative, I think, and it's very exciting indeed. Whether they'll pull it off is another matter, but for the moment. So I think there are innovations in there, but I think that sometimes with the whole system change one, it's much more difficult to judge how innovative it is. So I want to draw on some of those in these 4 points. What time did I start? 10 past-ish? Yeah. 10 past? Yeah, okay. So first of all, can we generate findings that are capable of leading to improvement? And I think that, you know, this immediately is in danger of becoming a debate about different methodologies and who takes what to be trustworthy and so on. And there's still some of that about, no doubt. And there's the sort of the challenge, the old challenge, which I'm ashamed to say I used in my inaugural lecture here in the university from Anne Oakley, which is, does the evidence allow us to intervene with the most benefit and least harm? And that's the question. Do we feel confident that we're doing what is likely to be best for the people with whom we're intervening? I'm thinking now of these service providers when I say we rather than you, because you don't usually determine the intervention, though you might be doing so. So I think going back to the first point, we stand a better chance of doing that if we basically keep listening from the beginning. And I still think a lot of research proposals that I see to review or reports that I see are still engaging users and service providers fundamentally in the steering of the project and in the end, and not so much at the very beginning to generate the ideas, to test out whether the ideas. I know that some of your projects do this, so I don't want to labour it too much. But I think there are two issues there. One is the stages of the process when it's appropriate, and the second one is the levels of people with whom it's appropriate. So you might get incredible buy-in from the social workers, but if the manager is not supportive, it's going to be very difficult for you to, in the end, get any real change in terms of your feedback saying, yeah, this is brilliant, it's time you rolled it out. And the manager's saying, well, I didn't know anything about it and I've got some other agenda now. So I think it's about the levels in practice as well as the stages of the research. So I've mentioned the second one already. I think where you see IP, I'm talking about the innovation programme. In the innovation programme, we've tried to reiterate the principle of fit for purpose in terms of evaluation. It's not this methodology should be privileged, it's what is the right method, the right evaluation approach for this particular project. And one of the things that I know Barry's encountered, and I have a lot across the programme, is that the evaluation teams designed what is perfectly reasonable evaluations for what they were asked to do, and then the project changed. And that's happened quite a lot, and it's made it very difficult for the evaluation teams, especially in that short time. So having that kind of interaction from the beginning and trying to help them to see that when they start tweaking things, you'll need to tweak things, that's quite a challenge. And working through, just before we get on to those two, I want to just shift to the next slide. This is a paper that was published in 2009. And I meant what I said. I'm not trying to privilege particular types of methodology, and I've slightly, it won't add up exactly to 625 because there are a lot of other categories in here. I've slightly adjusted it to make it a little bit more, a bit easier to digest. But basically, I think we do have some areas of work, and I know there's some exciting work going on here with Cardiff on this quantitative data set analysis and any kind of trials and poor old systematic reviews, which at that time, and I'll just tell you what the way in which this was done. So this is studies were identified from research on child and family social welfare funded by 5 major UK funders between 1996 and 2004. And I think we can say, I suspect if that was repeated now, because the data collection was finished 2004, the picture would look a bit different. You think you would have more quantitative data. So I think there's been quite an increase in secondary data analysis. I'm not sure how much increase has been in trials. There's certainly been a bit of increase in systematic reviewing. So I think that the point I was trying to make there was really just that as a sector, it's very, very heavy on certain types of research. And those are the types of research, regrettably, that Chris Brown, as some of you know, found when he interviewed policymakers, they weren't very happy to make national policy on the basis of. Not really surprisingly, because it's not too far removed from the minister who says, well, when I was at school, setting never damaged me, or streaming or whatever, so I can't see what the problem is. One of the ministers did say that when I worked in the DFE. And, you know, we can't make policy on very small numbers because we really don't have any confidence about what's going on. And I think that the great strength in all that qualitative work is in trying to understand the processes. We do need it. So we still, I think, have quite an issue here for national policymakers. They're getting better at understanding, the ones who are involved with the innovation programme, for example, the value in mixed method work, much better. They understand that knowing whether something works isn't enough if they don't know how to make it work. So they are getting better at all of that. Working through the research to actually provide targeted recommendations that says, this is the job of X, this is the job of Y, to look at that. And taking account of context, well, that's something, again, you're very much more sophisticated at because of the work on international, those of you working in international contexts, know how difficult it is to transfer from one country to another. Within the programme, the innovation programme, we're having already, some of the projects have raised issues. For example, the Signs of Safety project that Eileen Munro is running have had difficulties because they've got 10 local authorities and they're all doing it a bit differently. Or Morning Lane has had problems with their social work restructuring because they've got 5 local authorities and they're all doing it differently. So I think that's a challenge, but nowhere near the challenge that some of you have already managed to successfully navigate with transferring stuff to other countries or transferring in from other countries. So the second challenge here, is this the second one or the third one? I think this is the second one. So the second one here is about the policymakers. And I think early negotiation of expectations is the biggest lesson I've learned, and it continues with the innovation programme. So when I hear somebody saying, what will be proved in March, I'm very quick to say, us social scientists never use the word prove, by the way. That's something we constantly edit out of other people's work. We don't like the word prove. We won't be proving anything, but we might have some idea about possibilities. And we've been very encouraged by Isabel Trowler's attitude, the chief social worker, because she said from the beginning, all we're expecting by March 2016 is to know what looks promising. And I find that quite reassuring, because we will know something about the process. We'll certainly know how long it takes to appoint people to projects, which is causing mayhem across the whole programme, but also what looks promising. I'm going to skip a few of these in the light of the time, but trying to negotiate with policy people about the research questions, about the exactly what it is they're trying to do, and the evaluation approach is very important. I mentioned timing because I think very often we produce a piece of research and then nothing particular happens to it and we're disappointed. And I always remember Paul Black in education at King's, who said when the Key Stage 3 strategy was introduced in education by government, How come I produce a piece of research, a major piece of research, and everybody says how good it is, and it then takes 18 years to influence the government? Now, that was because the time was right. At that moment in time, that was just what they were looking for. So I'm sorry that some of you will be quite a good deal older by the time your research gets used, but don't give up, because actually there can be a time later when it's more useful. And we do have to accept that, you know, people have different priorities at different times. It's probably true to say your research probably has a lot more effect than you think in terms of stopping policies that are found not to be successful, and those kinds of things tend not to be publicised. And I think that's very important. And it came up, I think Imogen will remember, it came up as a major issue, didn't it, in the ref. People were very worried about impact not being judged when something stopped something from happening, because it tends to get hidden and much more difficult to evidence. But I think people really looked out for those kinds of examples. Okay. Some of this is fairly obvious. I just wanted to make this point because it came up again recently in something I was involved in. Senior civil servants can be in departments for years, and so they yield enormous power because they control the information. So we need to be a bit savvy to the fact that they need to be targeted just as much, if not more, than the ministers. Obviously, there are a lot of civil servants move about, and that's also very frustrating for us. But the fact that they control the resource and the information makes ministers very, very dependent on them. And then finally, I just want to reiterate this obvious point. They don't want to know what the problems are. They need to know what the problems are, but they don't want to know what the problems are. So your job is to always finish on the can-do, whatever kind of meeting you have. This is what you could do. This is how you could approach it. Always be ready with that, and that's going to be something we're going to have to try and talk up in the innovation programme without losing our research integrity. Okay, this is the one that's most challenged us recently in the Rees Centre, and that's trying to, having got the resource allocated, to having someone working in the services, trying to get the actual practitioner researcher interface right. And there are a number of projects in the innovation programme that have embedded researchers, and we're bringing them together for a meeting in mid-November, and we're going to have a webinar on embedded researchers, which I hope some of you might join in on in January. And we are very, very much trying to move forward with what are the models that might work of having people actually based in the service, because it is extremely difficult. It was very difficult for me in 2000 and whenever it was, 1997, straight after the election, when I was seconded into government, because people kept well away from me. They steered clear. They never mentioned anything important in my presence, and so on. You are interloping into a different culture. You are a stranger, you are a threat, all of those things. And that happens when we try and have a researcher working in a team of social workers or somewhere else. And it will be interesting to see. I think we've got about 6 or 8 in the innovation programme. Newcastle, Stockport, Islington, a number of them are working with embedded researchers. And it will be interesting to see how they work. I just wanted to make a couple of points here. One is I was interested in the recent paper that Mel Gray published, the survey, which I don't know whether you were involved in that study as well, were you, Elaine? Right, which was really interesting because it wasn't what I think we would have all expected, and clearly she expected to find them saying, just give us the bullet points and get on with it. Actually, some of them wanted to be engaged in the whole process. They didn't want just the guidelines, just the outputs. Secondly, drawing on some work I looked at when I was doing a review of think tanks and their role in implementing research findings. Diane Stone, who's a political scientist, talks about recycling garbage. I found this quite a helpful notion, because I know when we were in the education department here talking about school-based researchers, that this was a great worry that people had, that somehow school-based researchers would be drawn into the culture, even if they come in from the outside, or if they're an existing member of staff, they were in it anyway, and would simply be regurgitating garbage. And I think there's some evidence in education that, for example, if you look at the role that learning styles has played, and possibly in social care, in some of the specific interventions that have been latched onto as the kind of bullet answer for everything, of that kind of behaviour. And so perhaps where we went wrong in our work was we didn't have our managers on board. I don't think the managers were really understood what it was we were trying to do with having this person sitting in their team, bringing research into the situation, trying to stimulate evaluation of the service. And so I think that needs more development. I don't know whether these are different models. The researcher in residence model that ran here at this university wasn't the same model at all. It was about doctoral students. It was RC UK funded, and it was doctoral students learning to communicate about their research in school. So that wasn't the same. But we're talking about somebody who rolls up their sleeves and works alongside, I think, practitioners to try and feed in and stimulate the use of research in everyday decision making. And I still worry about the fact that this isn't really sufficiently reflected in the professional standards. I don't know what the debate is in social work. I know that in teaching it's gone backwards, unfortunately. We don't have, with the demise of the National College being sort of absorbed into the department and becoming much less important, we don't have a professional expectation stated in the standards to use research in the way that doctors do. Right, it's going to be 3 minutes more and we're going to stop. Right, okay. So the integrity, as I said, I think this is one of the things you're definitely good at, so I'm not going to spend too long on it. I used this quote, this paper by Christopher Winch years ago, a philosopher working in education, who said, beware of sponsors, of you ending up giving sponsors just what they want to hear. I had 2 incidences in Sussex when I was here, which were particularly problematic in this area. One involved a sponsor who tried to get early findings out of us in order to basically, polite way of putting it would be restructure the staffing in the organisation involved. And the second one, who was so desperate for good stories because the future funding depended on it, they constantly tried to reword things to make them sound more positive than they were and to try and play down the negatives. And I'm sure you've all had that experience. Evaluations are very, very problematic on this particular issue because nobody invites an evaluation wanting them to find bad things, or not that I've come across anyway. And you probably wouldn't take on an evaluation of something you thought was basically really bad. So we always have a problem there. So I think he also notes the opposite, which is being excessively true to yourself and never being willing to give away anything. For example, I've also been in that situation with collaborators who won't tell the sponsors anything until they get to the end report, and that's, I feel, is also not acceptable. So I think there's a balance to be had there, and to reiterate the principles by which you operate politely to the sponsor, and to try and, again, I would link this back to the initial expectations, and to look to your colleagues for support. This project, which was a review of mental health in looked after children, sponsored by the NSPCC, I'm not going through the findings. I simply want to say that the NSPCC were brilliant on all of this, absolutely brilliant. And I think it's because they have people who they employ some people who understand quite a bit about research. Their expectations were very clear from the beginning, although we had to work incredibly hard for them. So it wasn't brilliant in terms of funding time, but it was brilliant in terms of all this relationship and getting the expectations right and being willing to be critical. But of course it's not their service, they're working with other services out there in this instance. And they have also planned from the beginning.
It's
disappeared.
External context has become externalized.
So these are the things about the external context. You can't read that, so I apologise. These are 10 barriers that McKinsey came up with for barriers to radical improvement and innovation in children's services. I think when we have, people will have access, won't they, to the slides, Sebba, so they'll be able to see the original. And I think you'll find this quite useful because it talks here about, significant, these are the kind of stimulus for work in this area. Significant growth in demand, i.e. more looked after children or whatever. Confusion of the state's role in the sector and so on, budget pressures. And then it talks about structures. So service provider instructors aren't always incentivised to improve services. Well, I'd say neither are they incentivised to use the evidence. And then conduct here, barriers to conduct. And then what does the last column say on the heading?
It says performance.
Performance. So high variability across LAs in child outcomes, limited correlation between spend and outcomes. We would be very careful about how that kind of stuff's used. A significant gap between cared for children and other children. So that's some of their, I think you find that useful. I found it a useful way of thinking about the innovation programme progress. And in fact, the innovation programme used it in its original construction. Okay, so what we've been trying to do in the Rees Centre to tackle some of this is to develop something that I think I've talked about here before, but develop knowledge claims. And these are statements that we think, not just our research, but lots of people's research, can support strongly enough that practitioners and service providers should be challenged with them. And I suppose what I'm trying to do here is to say, depending on what context you're working in, so these might not be relevant for many of you, but if you take a knowledge statement, a knowledge claim which you can develop in your own work, which is something you feel is strongly supported by research, and say, are the organisations I'm working with, does their practice reflect this? And this is the way that we've been trying to work with the services. So we would say to Oxfordshire County Council, which we have done, how do you prepare and support foster carers' own children to begin fostering in the family? What do you do to prepare them? Because when they're properly prepared, we get better results. We get less placement disruption, etc., etc. And so it's a way, do the social workers that you train, i.e. Sussex University, because we don't train any in Oxford, regrettably, who become supervising social workers, challenge foster carers as well as supporting them? Because Helen Cosis Brown's review for us suggested there was an awful lot of support, but not very much challenge. So those are the kind of ways in which we're trying to work, is to develop things which we feel we can put hand on heart and say, this is strongly supported by research. What should we all be doing about it? Okay, I can stop there.
Thank you very much.